that we would like to say a certain amount of money out of what we have from cannabis or whatever, whatever source it might be, that we should just provide stable, ongoing funding so that a program can get not only set up, but can be supported and continued. And so that's my concern as we see this circular connection back to the annual budget. And I can tell you the list, we're getting requests from, and then once you have a program and you have a provider, you have a constituency, there's a natural desire to see it continue. And I understand that, but it really raises the question around, as we've allocated some of these revenues into prevention, how we think about those dollars, and how are there certain areas that we should simply say, these have a timeless, ongoing benefit, and they ought to have some assurances of funding. If I've articulated that
clearly, you've articulated it incredibly clearly. I was actually going to joke and say this is the first time I've sat in the seat and haven't felt anxious because I don't have to testify on budget, and I now amped back up to anxious because I am not entirely sure that what we've prepared answers all of those.
I don't expect you to answer it.
Okay.
I'm putting it out to say, because we have different councils, we have different groups that have
Absolutely.
oversight over the money, and they're looking at that piece of money, and that's why we created your position, to think about all the different ways that we're trying to address prevention.
Yeah.
Are we hitting the right kids?
Yeah.
I know, I'll give an example. We had kids from my high school, and they're here for BCATs. And 3 of the seniors, one is a green and gold scholar, 2 are accepted into mechanical engineering programs. And it was like, these are really wonderful kids. They're bright, they're talented, they're driven, but they probably are not the kids that are at greatest risk of making maybe decisions that long-term are going to come back to haunt them, or are going to be susceptible to violence or drugs or whatever. And so I just, as we think about the revenues and our desire to make prevention better funded and more strategic, how do we do it in a way that it gets directly to where the risk is the greatest, and we've tried to do that in a variety of ways with workforce, because historically, if you didn't do well in school, you could get a fairly decent job. Those days are gone. We've got too many kids on the margins of our workforce, and we talk about our birth rate and our demographics, but we can't forget that human capital that we've got here that really has potential, and we can't neglect that or ignore it. So with that said, I just want to throw that out.
No, I appreciate that.
And I don't know how many different councils we've got. I don't know how many different prevention funding sources we've got. I don't know how many people are making decisions about how it gets directed. But I think at some point we've really got to put it together, rationalize it, and making sure that we are using those precious resources in the most strategic and the most beneficial way. And I know you didn't come prepared to talk to it, but I never folded the script, and I want to take advantage of your presence and articulate it, because I just see that we're seeing it here, and then a program will come in, and a department will say, that's not where we want to, but then they come in and say, well, we do good things, fund us. And the departments, then you're into that position where the department would say, yeah, they do good things, but based on the composition of the kids or what we need, that's not where we would recommend that we put, but it becomes hard. So Senator Lyons, I'm glad you're back, and we'll see you on TV tonight.
Oh gosh,
Maybe.
I never watch it, so I. But can I just say?
You may, you certainly.
Because I know that you've been so important to prevention, and that we consolidated a number of our boards and their responsibilities, their dollars, for primary prevention and the Prevention Council that currently exists, which is a cross-agency, cross-department council in Department of Health. And so one of the concerns that we might have is if we begin to treat each symptom. So for example, violence is a symptom of trauma, perhaps trauma, or some of the problems that folks have around social determinants of health. There are a number of things that can cause that. If we invest all of our money into that one symptom or one section, then we miss so many others. So the concern that I would have is if we start investing all of our money here, then we're leaving barren everything else that needs attention. And making connections is critically important, and I think you understand that. I'm not trying to say you don't understand that, but we've had a trauma prevention director in the Agency of Human Services. We have a chief prevention officer, and now we have a chief prevention officer for violence in the executive branch. So I am personally looking for some reassurance that the funds that we have available aren't diverted to something that is appearing in the news today and not looking for upstream preventing problems downstream later on. And that the programs that we're initiating are those that are truly evidence informed or evidence based, and that will address some of the social determinants or individually the adverse childhood experiences. You know, there's a difference there, but so putting the things together that I'm talking about, Senator Kitchell is talking about, then maybe we come to a place where that's where we have our questions. How are we addressing prevention overall from your perspective?
I guess we ought to give you a chance.
Wait, I also want to ask.
Yeah, Senator Perchwick wants to ask. Senator Sears, do you have a question that you want? But we do see, obviously, from a funding perspective, what it's doing, and the list of people coming in saying, you gave us money last year, if we're not getting it again, you know, give us more. And so we're sitting here as a committee with over $400 million of requests. And so and so it's not just a theoretical discussion we're having, but it seems like as we've created this expansion of programs, interventions, staffs, et cetera, at some point we have to step back and say, do we have to re-engineer it here? And so, and you're the chief engineer.
The two chiefs.
Yeah, so for the record, Monica Hutt, I'm the Chief Prevention Officer for the state of Vermont. I sit in the governor's office.
My name is Dee Barbic, and I am the director of the Violence Prevention Task Force.
So what we try to do.
Dee, where is the task force administrative home? Is it
My office, I'm in the governor's office.
in the governor's office?
So what we try to do, and we'll bounce back and forth a little bit, is and it may be just the beginning of a conversation, so I recognize that I might not hit all of what you're interested in, but I think we can lay some groundwork to explain the two different roles and how we are intersecting. And then I just called, both of us sort of looked back at some initial conversations that you were having in committee and tried to pull out some questions that we thought you might have had. So the cannabis fund and the opioid settlement dollars, I want to be able to at least lay some groundwork around those. And I come back, I'm going to fling it.
Yeah, that's
Senator
good because
Starr.
we have H222 coming in here.
Yes, so I did
We
see
want
that.
to see that intersection.
Right.
And we understand that it comes with the parameters of the settlement, but nevertheless, how we think about it in the context of the larger, it's something we want to
So
hear you talk
we may
about.
leave you with more questions, but at least I think we will give you some groundwork and then we can answer. I already wrote down, Senator Kitchell, some of the other questions that you asked, which are great, and I'm happy to have more conversations. So let me just start running through, Andrea, if you don't mind pulling that up. I don't know where I'm supposed to look.
Over here.
That's in some other communities, it's right behind you, so you have actually no idea what's happening. It's somewhat intimidating. That would be good.
Just the clock is inactive.
Oh, okay. So you can move ahead one time, I guess, thanks. So I just wanted to ground this a little bit, because I think one of the conversations, or what I heard as a subtext for some of your questions, was where is this actually connected to? So the chief prevention officer was created, the chief, the violence prevention director, how is it all connected? And it is heartening to me to realize that from a state government perspective, we are looking back and looking at outcomes and information about things, specifically when we think about the recovery and the revitalization of Vermont following the pandemic, because the last few years has been phenomenal, right? So I didn't build in all of the metrics, but I can certainly get them for you. But in healthcare and education and housing and public safety, we have regular meetings across state government with agencies outside of human services, all of the agencies, A&R and transportation and public safety, to look at mental health and substance use and metrics so that we can actually understand what's happening in our communities. So ER visits, the number of beds that are available, deaths by suicide, trying to really pay attention to the data that tells us what's happening in our communities, how we are recovering from the last few years, and then beginning with revitalization work. Because we don't want Vermont to just recover. We want us to move forward and thrive in our community. So it can't be just we're gonna get to where we were. We want to get to where we were and then move forward. So looking at metrics in healthcare, looking at our education metrics, looking at metrics in housing, and looking at metrics in public safety. And Dee will talk about this a little bit more, but I think that I know that there are some really unique collaborations happening between human services and public safety to recognize that the violence and the crises that we're seeing in communities are symptoms of bigger issues, and that we have to get ahead of it, but we also have to address them as they're happening, because communities are feeling on edge and unsafe in some instances, and that's what we want for Vermont. So all of our work right now really is grounded in those metrics, which we review, again, across state government on a regular basis. And there are people that are far better informed on this than I, that I can make sure come in to speak to you about those metrics. But just to start there.
I appreciate that, and the idea that they're being reviewed across government. What's on a simplified level, what does it look like if you determine, let's say in terms of ER visits, there's a problem?
Right.
What does that look like across government?
So thank you for asking that. It was getting really busy on the slide, and so I couldn't put much more. Under each of these areas are initiatives, and some of them you're seeing in the budget. So think about as one example, I can't remember what it's called now.
Maybe the blueprint?
Well, the blueprint was certainly one of them, but I was specifically thinking about an ER alternative. Oh, in the Northeast Kingdom.
Oh, yeah.
The ER. Oh, yeah. So each of these areas has initiatives under it, many of which you see reflected in the budget. And again, I can do that work and send it over to you so that you can see. But in each area, there are initiatives underneath those metrics, underneath those areas of focus that are trying to address. And I think this is where you start to connect this idea of grants or pilots. You want to put money into something and then see if it actually makes a difference. So that's where the metrics are so critical, right? So each of these areas has initiatives. Some are in the budget, some are just ongoing initiatives that we are paying attention to the metrics to see if the initiatives, once they start or are initiated, actually make a difference in the effects. So that I think is important, but I can get you that information. Because again, it just was getting to be too much on the slide, and I didn't want to overwhelm you. I wish I had a clicker because I don't want to keep.
Oh, no, you're good.
Thanks.
Before you go,
Yes.
the heat map under public safety, it doesn't tell me much that you have a heat map. What do you do with the information? For example, I can tell you right now, if you go to Bennington and go down Pleasant Street, that's where the heat is. What are you going to do about Pleasant Street and the Horseshoe Building?
So,
Perfect,
I think that's
the
the,
perfect segue to the next slide.
oh, good.
so, yeah, so the next slide talks a little bit about the Public Safety Enhancement Team, which is an effort that AHS and the Department of Public Safety are spearheading, part of the 10-point plan. And exactly to your point, Senator, is they look at metrics basically on incident reports, incidents that come in, what are the highest numbers, domestic violence, and we're looking at violent crimes, domestic violence, assaults, robberies, those kinds of things. And we look at where different towns are. And they, you know, when we say heat map, it's the more numbers in certain criteria will become red. And so we look at those hotspots. So Bennington, as you mentioned, is one of our hotspot areas related to violent crime. And so we look at that every week. And one of the initiatives that the Public Safety Enhancement Team, or the PSET group, has done is they're now working collaboratively with the police department and the community, the leadership within the community, and basically weaving in state resources and assisting the towns with identifying what their biggest need is. And then how can we loop them in with state resources and come up with a plan? And we work with the town. We're not taking the lead necessarily, but we're working with the town to, as they identify where their biggest need is and how can we facilitate getting those resources to them. So work has just been done in Bennington. Jim Baker was doing a lot of work with that. We now have, they just had a summit where they brought together a number of community members. They've had focus groups that have been working for months to identify, you know, what are going to be our goals, what are our timelines, and then we can go back and look at those numbers. And our goal obviously is to see those hot spots not be so hot anymore and those numbers start to come down. So it's really weaving in all of these different resources and then looking at the next hotspot, which, you know, Springfield, Brattleboro.
Let me ask, so you've identified it, everybody comes and you've got the data. What are the kinds of interventions? Obviously Bennington's a border town. I bet probably people are saying, we joke that maybe we ought to have a fence, you know, a wall between Bennington and Massachusetts. So what kind of plans or strategies are put in place after you've had these discussions? Because Senator Sears obviously is reflecting the level of violence that he experienced in his area of the state. So how do we take that and translate it into a set of action steps that directly, so if it's drug use and illegal sales, like in Burlington, I guess they've had a lot of
Drugs,
deaths.
guns, sure.
Yeah.
22
So,
shootings.
for example, if you could make it more tangible, or to take it from the discussion to actually what do you do in practice?
So for example, you know, one initiative would be if there's a large scale search warrant done for drugs. The idea is to intervene with other resources, drug rehabilitation, for the folks that are relying on that source of product. Now, all of a sudden, their source is gone. We know that others move in, so one of our goals is to prevent that from happening, and that may be a public safety law enforcement perspective, but from a human services perspective, it's getting the resources in for rehabilitation, getting folks addiction treatment, but it needs to be timed, and that's where that collaboration comes in. So there's communication, collaboration. That's just an example of, you know, how we can, you know, intervene and as a preventative measure.
So Senator Lyons, and then
While you're talking through this, my question is, how is this different from having a prevention base that we currently have? I understand now public safety will be taking the lead in identifying illegal activities, but there are certainly cases where we're seeing problems that are traumatic events, which don't wouldn't be a cause for public safety to be involved. I'm trying to sort out who's in charge here. Is it public safety? Is it mental health? Is it, so how are we putting the right people in place so that we're not creating stigma about some of the treatment needs that are in the community? So
that it's very much a collaboration, right, it's very much a collaboration at that point, and it's not necessarily prevention in the primary sense, right? Like you are already responding to issues that you are seeing. So at that point, you're looking at intervention and you're looking at treatment and some secondary or tertiary prevention. But in the example that he just used, so once an event like that happens, and we know that there's going to be kind of a large scale public safety response, Agency of Human Services is alerted to that prior to it happening and make sure that local offices, our local Office of Economic Development, child welfare, the local Department of Health are aware as the event is happening. And so then you are aggressively moving into that community to say, here are where treatment resources are. Do you have economic needs? Like if you have lost your income or your family has lost somebody that was bringing in income through drug sales, that leaves a family without income. I mean, regardless of how you may feel about the activity, you're looking at a family that's left behind. So is that family being reached out to understand that they can apply for economic benefits, that they can get connected to services? Are your hubs or your spokes ready to take people on immediately to induct them with buprenorphine or Suboxone to get them set up to move forward? So it's that kind of we've never done it like that before. Project Vision in Rutland really envisioned that concept of bringing human services and public safety together and started that. But this kind of aggressive approach, I think, is a lot more than what we had imagined before. And I think really is trying to target exactly what you said, Senator, the idea that these are, that what we're seeing in communities are symptoms of deeper issues, and we have to try to get to the root causes of those issues. Recognizing that at that point we're kind of beyond prevention and we're just trying to intervene and almost restart for both people and families and communities.
So Senator Sears obviously spent some time on this because of the bill and looking at root causes and what we can support communities. Do you have comments?
Well, I comment, I guess, is that we're in a crisis state. And I'm glad that the governor and the administration have come up with this violence prevention effort. I think it's a good effort, but I'm concerned that it goes the way of so many of our efforts over the years. And S4 was an attempt by the Senate Judiciary Committee, and as was S89 and S91 on mental health. And there's another bill that we haven't done this year, S58. But we're in we're at a crisis stage in some communities. Bennington's one. I'm glad Jim Baker's there, but we can pull everything together for meetings. But I went down and I talked to the head of the local Turning Point Club. And the day I was there, she was telling me a story about a woman she worked with for about 4 weeks, trying to get her into, God, I forgot the name of the place. In your neighborhood.
Valley Vista.
Valley Vista.
Questions?
She finally gets a room at Valley Vista, has the woman all ready to go. And the day that she's supposed to go, she gets a call that the bed is no longer available and the woman has to wait. She said, that's the last time I saw the woman.
Boy, you lose them.
And you lose them. So we get people ready for whatever is available, and it's not available. And that's part of what I see as the real tragedy and the real problem. Now in Bennington, and it's partly our own fault. I tried methadone back when Jim Douglas was governor. That's how long ago when I first proposed it in Bennington, and everybody said no. Then when the hub and spoke came under Shumlin's administration, Bennington was going to be a spoke to Rutland.
Right.
But people with need for methadone from Rutland area filled that hub before you could even have a spoke. So today, 2023, we still don't have methadone available in Bennington people from Bennington have to go to North Adams, Mass, Greenfield, Mass, or Brattleboro or Rutland, if they can get into any of those. When they go to North Adams, they're riding in a bus, and luckily we're providing the bus. But there are people on the bus who are not as serious as some of the other people in terms of their desire to stop. So you get the picture. So if we can't provide the services, then we're failing in our efforts to prevent the violence. And this just, I've stopped calling them drug dealers. They're business, they're a criminal business enterprise. That's what is coming up from Holyoke, Mass. Into Bennington is a criminal enterprise. And it's no different than other criminal organizations. And they make their money by selling drugs, trading drugs for guns, bringing those guns back to Massachusetts, wherever. And they found Bennington to be a very accommodating place. Because we're so close to the Mass border, which is why we need the wall. Now,
Is that on our budget request?
but that's the scope of the problem. If the services aren't there, and we can't provide those services to these people, then we lock them up.
Well, let's ask, out of this then, taking the Bennington example, where treatment is not available, accessible locally in an easy way that might be which we have in other areas of state. How would your office work? I mean, in other words, what's underway to address that reality?
So I think that there has been a lot of conversation about Bennington, and I think that the senator has been at the forefront of that, and there is a hub opening in Bennington, I think by the fall. Is that right? So
I'll believe it when you see it.
I'll believe it when I see it.
I've seen enough media about it now, that I gotta believe it's true, but that is the plan. Obviously, that's going through the certificate of need process right now, and should be opening in the fall. There's also, I know, and I'm not an expert on any of the individual department budgets, but I know in the BDH budget, in the Division of Substance Use Programs, there's additional funding for bringing more beds back online in terms of treatment beds, recovery beds, both treatment, inpatient treatment and recovery beds. So I know that that's a portion of their budget. So I think that.
That's a huge problem.
Yes,
The lack of
agreed.
recovery beds.
Agreed.
As well as
Agreed.
recovery housing.
And I know that you've been looking at recovery center funding as well, right? I mean, I feel like the pieces are all there. I do. I know it sounds a little naive, but I do believe that the pieces are there.
Well, maybe you should say the pieces will be
The
there,
pieces will be there.
because they're not there right now.
They're not there right now, but I think even, I think that in all of your struggles around the budget, there are pieces that you will see, and you must be pulling them out as you're looking, knowing that those are the.
But that's
those
part
are
of the problem, they're not coordinated, in my mind. I, had a meeting today on domestic violence, which is the biggest crime in Vermont.
Yes.
That's the huge crime. About half of the inmates in Vermont are there on domestic violence or domestic violence related
Yes.
issues. And we're fighting over $300,000 for treatment of people in, not fighting about it. We will be next week. But for treatment of people who are in either under corrections and need treatment for domestic violence. So,
Is that in the government's budget?
well, it's confusing where it was. It has to do, it wasn't.
Well, I'm having a hard time with that one.
Well, it was $300,000 in justice reinvestment money.
Oh,
And then there were 200,000 that was in the base, but it should have been 500,000 total in the base. Top of the 300,000 that we provided out of justice reinvestment. If you remember the budget adjustment, we did the 300,000.
yes, we do.
But I'm just using that as a minor
Yeah.
example. So if we look at that as one place where we can really can we prevent future domestic violence? It's the one area I believe that all kinds of statistics point out that usually people grow out of criminal activity by age 35 to
Except for
40,
DV.
except for DV.
Right, and there's also, I believe, a bill around restoring justice for domestic violence that I don't even know where that is.
It is, I think it's in the House Judiciary. Is it the one going, the case is going to the restorative justice? Yeah. the
Well, that's in
CJCs.
Senate Judiciary. We're working on that right now.
That's you.
Yeah, that's me.
Yeah, that's the
My
domestic
Senator
violence sexual
Caruso committee.
assault case is going to the CJCs, I think.
Yeah, it's in our committee. Actually, it passed the House. We're
Okay.
dealing with it now. I think it's what it would allow them to be diverted into diversion
Yeah.
programs.
And I know that there's also funding in Department of Corrections for domestic violence, domestic and sexual and Department of Violence treatment.
Yep.
Is another portion of that. So you're right, there are.
I was specifically talking about domestic violence in this particular treatment mode for those that.
Is there evidence that in fact that's better response, just diversion as opposed to the traditional law enforcement?
I think it's dependent on the types of cases, the types of offenses. And I'm not familiar with the numbers.
Well, the advantage is that it would allow somebody to remain on the job, remain with all, their responsibilities and stuff. But
I think it's meant to empower victims.
But it-
as well.
Exactly,
Survivors.
it's got to be victim centered, because if the victim of domestic violence or sexual assault is uncomfortable with it.
Yeah, and I think-
It's not your restorative justice model, it's not gonna work.
Well, I understand that. I was just wondering what experience has been maybe.
Not much.
Yeah, I think my interpretation of the intent was to give victims more control over the destiny of their cases. If they chose not to go through the criminal justice route, this would give them another option.
The network could certainly talk with you about this, because this is their initiative.
I'm sorry, who could-
The network.
It's a network.
For the network against domestic violence.
Well, you hear from them for your team.
Yes.
But just taking another step backwards and going to primary prevention. So the investment that we've seen thus far is in criminal activity. And so, and that's been sort of traditional in our whole prevention world. So, and we do invest somewhat in kids after school. We've got the education up there, certainly after school programs, and that's certainly recovery centers for me are prevention recovery. But beyond that, are we doing as much as we can in the world of primary prevention so that we don't continue to need to invest in violence? And I'm completely on board with what is happening in Senate Judiciary working collaboratively. I'm also very sensitive to the work that you're doing, because it sounds terrific. In municipalities, boots on the ground, trying to distribute resources effectively. But at the same time, the more further upstream we go, I know that sounds trite by now, but the further upstream we go, the less we have to invest in that later on. So having that balance, when we already have prevention programs administrated, I think is absolutely important.
You need to renew your.
Set a trigger.
Yeah.
So there's not a lot of direct primary prevention funding in the budget. It certainly is scattered through different programs. Senator Westman was instrumental last year in making sure that we preserved the $3 million commitment that was in the governor's recommend, that the legislature supported, to fund the local prevention coalitions. And when I'm talking about prevention in those local coalitions, just to be clear, I'm talking about substance use, substance use disorder, and substance misuse. There are lots of different kinds of prevention. You can and should prevent many different ills, right? We can, everything from suicide prevention to child abuse. Prevention is this huge world. But when we're talking about that prevention money, the primary prevention dollars, we're talking about specifically the local prevention coalitions. There are 25 local prevention coalitions across the state of Vermont, I think, and 11 counties. So we're missing a few counties still. But they are local, they're nonprofit, they're tiny. They were buffeted by the winds of federal funding and have been for years. A new grant would come through from the federal government and it would say, you need to focus on tobacco, you need to focus on opiates, you need to focus on vaping. And those prevention coalitions spent a lot of time running after those federal dollars that the Vermont Department of Health was able to administer, but administered in these very strict areas, which is wonderful if it's leveraging efforts. It's not very sustainable or operationally stable. So that prevention funding last year, there was $3 million that went out the door in this year. There is a commitment in the budget for it next year. It's meant to be funded with the excise tax from cannabis sales, right? So the cannabis sales tax goes to after school. The cannabis excise tax, 30% of it was meant to be used for prevention funding.
And I know, and that's where so the mentoring folk for part of that 30%. I guess I want to ask, you just talked about federal grants and their
Correct.
response. Well, we've got a problem with smoking. We've got a problem with drugs. We've got a problem with teenage pregnancy. I don't know. We got a problem with this or that. It seems like when you're dealing with youth, that if you're engaging and you have a positive presence in their life, you're helping them make sound decisions regardless of life's temptations. And so it's sort of like looking at the world that's going to confront that kid, and it isn't just a decision around vaping or smoking,
Right, it's
drinking or drugs, etc. How do we design, and if there's a way that can intervene and support the kids, and oftentimes that positive adult presence can compensate for a lot. Then is there any research that says that yes, we don't need to look at your body parts, so to speak, or temptation by temptation or decision but how do we work with kids in such a way that we equip them to make good decisions and how to think through, and it just seems like what would be effective on one of these would be effective on the other. And kids who have aspirations, kids who have support, a sense of success, etc., have those skills. And I'm just wondering how we take all those, because so much of our funding is driven by a particular problem, and how we put it together in a way that, yeah, we'll take your funding for this, but it actually helps us support, this broader agenda of positive youth development.
Yeah, and we are actually I couldn't agree any more with everything that you just said, Senator. We are trying to draw the mentoring work in particular into our after school work, right? Because there's a real connection between what happens after school, after hours, and where mentoring really fits in beautifully to that. So it's interesting that you are equating it to prevention. It certainly is, but I don't think about it when I think about those prevention dollars, which are small. I mean, we're supposed to be at least be able to hit 3 million, and we're not even going to hit that this year. We've got one-time funding, and we're imagining some money coming from the cannabis excise tax to maintain that commitment to the substance misuse prevention coalitions. But in our after-school work and in our we've got I hate to say it because I know you all will wince, but we do have an interagency task force for after school, and it is an amazing. Senators well aware of that group. And we are drawing mentoring into that conversation because I think it's part of that package of supports and services that you can offer to kids that are preventative in nature, but we're really specifically talking about after school. And because we have this discrete potential funding source. Now the cannabis revenue is coming in a little lower than expected, just to be candid with everybody.
I thought it looked a lot lower than expected.
Yeah, I think it is. And that we shall see, I suppose. And it's funny, like the irony of counting on that for prevention and after school is not lost on me, so I will just acknowledge that out loud. But it's good that the resources can go to something that is positive. But we are really drawing the mentoring community and Mentor Vermont into the conversations with our after school group, because it feels like that's the place that they live most comfortably. And places like the Boys and Girls Club or Big Brother, Big Sister, who are part of our after school group, are also kind of mentoring organizations in and of themselves. So much of that answered your question, but.
Well, I guess, well, maybe we need to have more discussion. I guess what I would like to see and is the extent to which we could assure that the funding for mentoring is going to be available through that funding mechanism as opposed to a separate funding request that we're experiencing in the budget. That's really what I'm concerned about, and how to make that happen.
Yeah.
And how to do it as part of that package of ways that we serve youth and so that's really the heart. Senator Sears, you have a comment?
No,
Oh,
I'm
I'm sorry.
agreeing with you.
Oh,
Senator Purchase.
Senator Purchase.
What I've heard is that in the past, and maybe it's just a lack of the after school funding or trying to meet all needs, that they have said mentoring doesn't qualify as an after school program, and so they haven't been able to get any funding through that process.
So we, the cannabis sales tax revenue, there is a mechanism, I believe it's in the budget, it ended up making its way into the budget, that enables us to make sure that we can make the transfer from the cannabis revenue to the agency of education. And that task force is designed to administer grants. So over the last 2 summers, and even happening right now, we've been pushing grant money out the door. It started with federal dollars that were available through the recovery dollars, and we continue to actually try to enhance and expand access to after school programming across the state, because as you can imagine, there's not equitable access. Some counties are resource rich with opportunities and some not so much. So we've been trying to really target areas that are missing and lacking those after school resources. So the grant has to be designed when the cannabis revenue actually starts to move, and we can design it flexibly. It is a grant, just acknowledging that we had that conversation at the beginning, and that's very
Grants
intentional.
don't have to be competitive and unknown and predictable.
Exactly.
We move a lot of money out to
Exactly.
with grants.
And it's meant to sort of lift up something, there are different levels and I don't have that information for you, but we have different levels that we've designed in that framework, so that some programs might just need sustainability grants, some might need startup, right? Like if you have a great idea and you want to initiate something where there doesn't exist something that doesn't already exist, there's a startup component, and we want you to become more sustainable. So we're also trying to make sure that those connections are made between those individual private or nonprofit programs with school communities as well, because again, there's sustainability there when you look at 21C and what schools have coming in. So really trying to do exactly what I think you're challenging us to do, is how are you braiding these issues and this funding together in a way that it becomes a little bit more sustainable. And I really do feel like we're being intentional in the after school, which I would love to have to come in and talk to you more about and bring Kendall Smith in, because she's really been spearheading that effort. I think that that's one of our most successful efforts, just in terms of grants that we've gotten out the door, the metrics that we've seen, the access that we've created.
I think after school is wonderful. I don't. So, and obviously people felt that way because we dedicated revenue specifically for it. But how expansive we look at what can after school include,
Part of that, yeah.
I think is maybe the issue here. I want to, looking at the time, which I can see and you can't, we obviously we don't care what your slides say, because we just ask whatever question we want to
I
ask.
got the slide too.
Well, you can look at them, and I will just say, these are great slides.
I'm sure
They're
they
gonna
are.
talk about my role, they're gonna talk about Dean's role,
Well, we can read my
all the
question.
partners and connections, and the opioid settlement dollars.
I do want to go to the settlement and how that might connect or help or complement. Recognize it comes with certain limitations.
All right.
Exactly what we've been talking about.
Okay, and not because the advisory committee disconnected from all the other work that's going on.
So the advisory committee that I think you're talking about, Senator Lyons, is the
Opioid settlement.
there's another one. I do.
I know, that's how we feel. Oh my
I
God.
know, but they're all really fabulous, and everybody really is talking. I'm not gonna tell you, I'm not gonna
Maybe we could
walk you through.
consolidate the.
But we
number of
hit
meetings
funding
that we're
opportunities, and we've got emergency risk protection orders and the domestic violence working group. So I hope that in your spare time, which I know you have so much
Yeah,
of,
tons of spare.
that you, or tonight before bed, you go through and flip through and look at these, because we did try to hit as wide a swath as we could. But
It's like,
Andrea, if you could go all the way to slide 15. There we go. And I did talk to the Commissioner of Health yesterday evening to let him know that I was gonna be in committee and that I knew that this was one of the questions that was gonna be raised. He said, I would love to have them invite me back in to talk about this more specifically. So I will give you the high level, and Dr. Levine would be happy to come in and talk to you more. And some of you remember this because you were the people that created the opioid settlement advisory committee, but that committee was created last session. It lays out a very thorough and expansive and
Maybe we made a mistake. Maybe we
tiny
shouldn't
bit
have seen
slow
the
process.
committee to do that.
tiny bit slow process.
You're right.
Huh? Seriously, I mean,
We can
we're,
amend.
we're guilty of, oh my
We can
gosh, there's
amend the
another pot of
charge.
money, let's create another advisory group.
No, but
It was actually
the guidance
required.
document.
Yeah, the federal guidance for most of the settlements, all of the settlements so far is hundreds of pages long, and it actually does require that there be an advisory committee.
But
So
we
had no
could
choice about
deem
this
it,
one.
I don't, is there anything that could say, well, we've got one and you're also, we're gonna call you this too, so we could deem.
But that is something to look at.
Yeah.
Okay, because you do
But
want.
It's kind of late for that, isn't it?
Oh, no, we can always,
hindsight.
we can always,
Speak, okay.
our position has been evolving, so.
Guys,
And we have, I think, I will give
We
the
have 15
committee
years.
credit, I mean, they did move at sort of lightning speed considering what was up in front of us, so.
And I know it's unanimously supported, and so people want us to move it out because they want the money quickly,
I think
so.
that that's right,
Yeah.
and because it requires it requires the entire budget process, and that was really deliberate to make sure that the committee, the legislative branch and the executive branch all got to weigh in, and I, that is good process, it's just long process. So the next slide, we'll just talk a little bit about, the committee spent a little bit of time just trying to get organized, like what were we gonna prioritize? We did have this conversation about youth prevention,
Yeah, I
we
see
Senator Lyons.
And that is.
It was one of the things that we agreed to. We also agreed that that might not happen in this first year, that we were in a crisis mode and we needed to not be tone deaf to that particular crisis mode. And so that most of the funding decisions, all of the funding decisions you will see in a moment, I'm going to show them to you, are not primary prevention. And I certainly avoid prevention but also recognize that it's maybe not the right time. So on the next slide, this just gives you a very quick
Bennington.
Right, yeah.
a very, very quick preview of the decisions that were made. I didn't put the numbers here. It is challenging to
I think
understand.
Addison has got an extra vowel.
Oh, yeah.
And
oh, man.
What happens to?
And Dee corrected all of her typos, and I was very blunt and like, oh, I didn't make any typos. So, yes, it does. Just an extra O. It's a little gift. That's terrible. I used to live in Addison.
Just
County, so
demonstrates that we're alert.
that is true. And I put that in
Senator
there just to
Kitchen.
make sure. So these are the recommendations that were made. The funding is weird. For you to use a technical term. I mean, we don't exactly know what's coming in. There are 3 different settlements, a 4th on its way. The way that the money is getting put into this national fund to be then distributed to states, it is incredibly complex. Simple and complex at the same time. There is a national administrator for all of these dollars for every state. Some money goes to localities and municipalities. Vermont is one of the few states that doesn't have county government. So there are a couple of tweaks and twitches that Vermont needs to do to make that work. There is some money that goes to actually pay the legal costs of having had this huge case happen, but the bulk of the dollars goes into the abatement fund. So we think that we have, in this moment in time, about $10 million in that fund. The challenge is, and this will ring true and dear to all of your hearts, is that you cannot fund ongoing programs if the money's not going to be there? Now, this is an 18-year process where money will be coming in, but we don't necessarily know, it fluctuates every year how much money actually comes into the fund. So trying to strike a balance between funding ongoing programs now and then not leaving them high and dry in the next 17 years of funding, and then trying to leave a little bit for one-time opportunities that might not come our way otherwise. And, 3 or 4 pages of what you are allowed to spend these dollars on, because it's very, very specific. These were the decisions that were made for this upcoming year. So for fiscal year 24, this is what's going to be happening. So expanded naloxone distribution, not just more naloxone, but things like vending machines with naloxone and putting them in places where community can get to them quickly. So some really innovative approaches to that. Opioid medication units, sort of increasing where, I don't know if it's methadone and buprenorphine or just buprenorphine, but additional sites, one in Addison, one in Eastern Vermont in that corridor.
It can be done in a primary care setting. This is where we're getting.
So this is more like the hubs, like hublets was the word that got used in committee. So tiny hubs. So I guess it is actually methadone now that I'm saying that out loud. So a few more sites and one actually expansion in a DOC facility where there seems to be a gap. Putting outreach workers into the 26 preferred providers. So part of the issue, and I think you've all articulated this, some people are walking into treatment and saying, I'm ready. A lot of people are not ready or are not yet at a place where they're going to walk into treatment. So making sure that we can push outreach workers out to draw people in so that we're not just waiting to see who walks in the door, but are being a little bit more proactive about it. Funding for a contingency management program, which is a new emerging strategy around the use of incentives to maintain people in treatment that is seeing tremendous success in the Chittenden County area, pushing that out and expanding it so that we can continue to measure that success. But it's a really basic strategy, right? It's very basic behavior management, I think, in the sense that if you can incentivize something, people will stay connected to it, to try to keep people in treatment. Wound care telehealth is specific to the xylazine that we're seeing in opioids. It actually creates this, I'm not professional, but it creates a really adverse response and your skin starts to break down. So making sure that we can address wound care. And then expanding our access and production of fentanyl test strips. Xylazine test strips are also coming on the market within the next 6 months, which I did not realize. So being able to push those out so people can actually see what's in what are in the drugs that they're using and make educated decisions about that. So hopefully reducing overdose deaths. So that's what's happening in this cycle. And again, Dr. Levine can come in and give you far more information.
The dollar amount that for.
It's less than 10 million. I want to say it's around 7.
7.8 or 7.3, but it's going to be an
Or it could be
H222.
exactly 7. But because again, it's very difficult to gauge the money that's coming in and what's coming out.
So
You
the
want to
House
make
passed it based on the recommendations from the advisory committee. They didn't make any changes. Okay. And the committee, right now, the bill's been assigned to you, Judy?
Yeah, we took testimony this morning.
Well,
We'll be taking
So
testimony.
you'll be talking to Dr. Levine then.
Yeah, we had Department of Health in today. We don't have that again.
So we are gonna have to rely on our other committees.
Right.
Because our ability to relitigate every funding request in all the entire state of Vermont budget is somewhat limited.
Well, in this one in particular, where the guidelines are being followed, that
I mean, they're broad, but they're specific.
they are very specific.
But you know as well as I do, depending on how people look at it, some people see delineations and others see possibilities. So, if there are other ways, 26 preferred providers, could you tell us who a preferred provider might be? Are we talking about the actual hubs and spokes there? Are we talking about, I'm not sure who is in that preferred provider category.
So the preferred, I don't have a list, but I can get you that. Preferred providers, most or almost all of our designated agencies are preferred providers, but there are also other entities that are specifically just substance use disorder providers. So the preferred provider is just another delineation, like when we talk about a designated agency, preferred providers are just the way that we name those entities that are working on behalf of the state.
I just
for
didn't know,
substance use. I can get you the list, Senator.
who felt who were preferred as opposed to not preferred.
Is a way of saying, it's like a designated entity tag for those providers that are working through with state contracts in substance use disorder treatment.
Okay. Well, we're gonna have the bill once we get it. That Health and Welfare Committee could get
Yeah,
on
you better
the
get
dime.
When are you
you
gonna
know.
get ready?
Oh, well, spin it around probably
How
in
are
a
we
half
gonna
an
get this
hour.
incorporated? If you can't
It's all on
do it?
your shoulders, Senator Lyons.
Well, I'm just waiting for these two to help me out with it, that's all.
We are ready and willing.
So I do have a question though about the work that you're doing on violence, because as I read S4, the language seemed to be really good, because it talks about being based in the community, identifying community and municipal needs, and then responding to that. The concern that I had when I heard it was $10 million going only for violence, that was a concern. If all of the activities that we are seeing for prevention are part of a system, so that's the concern, is that all of the work that's going on in Department of Health or with mental health and public safety, if there's that systemic approach, and you all know this requires X amount of money, this requires this amount of money, that we can then assure ourselves that we're taking care of both prevention and intervention and
Countdown to Nirvana.
treatment. Yeah, that's not easy.
No, it's not.
No, I know it's not easy.
Well, on the,
We didn't mention truancy, but it's a heck of a guide right now to some of the future problems. And I'm hopeful that some of the, like in communities like Bennington, there may be an effort to deal with truancy, because we recognize that as a real sign
Absolutely.
of risk of further problems. And usually those are, I don't want to generalize, but many times those are dysfunctional families who are having a hard time. And so the kids, whether they go to school or not, doesn't matter.
It's a sign for sure. And absenteeism and truancy are in the agency of education measures that they are looking at, and we are starting to really talk about that in coordination with Department of Mental Health and the Department for Children and Families. So almost wanting to start looking at the measures, AOE's doing their work to try to manage that and mitigate that, but also recognizing that if we looked at, for example, families that are connected to the foster care system, and then really looked at their absenteeism and truancy, not necessarily kids in foster care, right, but kids that are connected in a not yet full way,
Somewhere.
right?
But
And
it's
how
also
can we intervene
even-
and impact that?
Speaking of hotspots, there are certain areas in Bennington and other communities where that absenteeism or truancy is much more highly prevalent.
Yeah, that would make sense. Interesting. Yeah.
That's literally what I was just writing down, yeah.
okay, I was just looking, you can't see the clock, but it's,
You're taking up a lot of your
well,
time.
it's 25 of 4. And we still have another agency to come in 10 minutes. So unless there are further questions, do we have, Dick, you also?
I'm not.
I know you have to, I had Sal, and we'll rely on the binder.
Do you want all the metrics in your?
They're not, I will
Oh, I'll be back.
Yeah.
I didn't put them in, but I have a note to myself.
Okay.
Obviously, we'll
Yeah,
work
we
together
need-
to develop that, so that makes it clear.
No,
that
I'll be here
actually
Tuesday.
We're gonna meet the following
And we really are looking at that, which is,
Yeah,
it's,
okay.
I know, I
You
know.
can't meet the following Monday, that's Patriots Day.
Well,
I
this
guess-
Monday, what's that?
The marathon,
Oh, my God. No.
all of those exciting things. I mean, it's a holiday in Massachusetts and
Well, we have a
parts of
budget to
Maine
get
and New
out.
Hampshire.
They meet on Bennington Battle Day,
Yeah.
so I have to meet on Bennington.
All right, thank you very
Thank you
much.
so much.